we're going to get into this right here. I want to start off by asking you, Dr. Dean Ornish, who's our friend, is often referred to as the father of lifestyle medicine, and he gives great praise to your book, and he highly recommends it. He says that Anticancer Living will empower millions of people with information they can use to reduce their risk of getting cancer and improve their chances of surviving a cancer diagnosis. Explain what is Anticancer Living, and please share how the knowledge contained in your book can empower individuals to reduce their cancer risk and improve cancer outcomes.
Well, let me just start by saying thank you to you, Gabe, for having us today and everything you do in supporting health and wellness, with the focus, of course, with Blue Cure on men. But as we'll talk about today, it of course applies to everybody, and it of course also goes beyond prostate cancer. We were so honored that Dr. Ornish was giving words of praise for our book, and you know, what's an important place to start is to understand that, you know, somebody like Dr. Dean Ornish, who is a physician who showed that you could actually reverse heart disease through comprehensive lifestyle change. And he actually did that work here when he was in Houston, and used the Warwick Hotel as the place to actually do this intensive intervention in these men that had essentially fully occluded almost arteries, and showed that you could reverse this. And to have a physician's voice in this game with us is just critically important. So we're pleased that he went on from heart disease and is also involved in the world of preventing and slowing down cancer as well.
So what is Anticancer Living? Well, it's the relationship between lifestyle and cancer. And we talk about 6 areas that we call the mix of 6. And they are love and support, stress, sleep, exercise, diet, and exposure to environmental toxins. And what happened and how we got here was that Lorenzo would come home from MD Anderson and the work that he was doing there and colleagues were doing and those around the country. And we started sharing this and looking at our family and looking at ways to live a more healthful life. And what we realized that we were in kind of a unique position, and that surprisingly not all doctors knew about the research with cancer and lifestyle. And certainly, you know, the vast majority of people did not know it. And so we started speaking in our community and around the country, and realized that we wanted to, you know, put this important information down in a book, because ultimately, if you have a cancer diagnosis, you want a body that's inhospitable to cancer. And one of the women who is, whose story she shared with us for the book, Nella B, said that, you know, I don't want to give cancer any more of a hold than it already does. And that I know that there are things that I can do to that can help my situation. And so what we really are trying to put together for people is a whole package of what the science says about cancer and lifestyle, what are strategies and ideas that you can put into play to make change in your own life. And let's hear from some people who are in situations, some very significant, and dealing with a cancer diagnosis.
And a key ingredient that keeps surprising me, unfortunately, that is missing in all of these areas of lifestyle change in terms of the interventions that are being done in the community, the research, and even some of the guidance that's given to patients is these areas of the mix of 6 are all important, but they're compartmentalized. So there may be an intervention or a lifestyle program that talks about diet and exercise, or, you know, getting people to eat a vegan diet. And then there's all this excitement about the keto diet. But they don't talk about how all the components interact. And this is a key section of each of the mix of 6 chapters in the book is, what's the evidence show on synergy? how can, and we'll get to this later probably, how can stress disrupt your ability to engage in healthy lifestyle? If you don't sleep enough, it changes your metabolism and changes the way you process food. If you don't sleep enough, it makes it hard to engage in an appropriate way with your loved ones. If you don't have enough social support, then it's going to be hard to be successful in all these areas. So the synergy of the mix of six is really the active ingredient, let's say.
So with the mix of six, you all probably know then what % of cancer and cancer deaths can be prevented. Do you know what that is?
You know, it's somewhat up to debate, and there's different statistics in different areas, but I think it's probably safe to say that at least 50% of cancers and cancer-related deaths could be prevented through lifestyle change. And some estimate that it's even higher, and certainly for some cancers, it's not debatable, for example, that about 70% of endometrial cancers are just due to the three factors of overweight, obesity, diet, and exercise. So we're not even bringing in some of these other factors into that situation. We know that 30% of cancers are attributable to smoking and tobacco-related behavior. Diet and exercise and overweight and obesity in breast cancer accounts for over 30% of those cancers. Again, we're not even talking about stress and exercise and the environmental toxins. So, you know, clearly half of cancers could be prevented and cancer-related deaths.
So then why is there not a stronger emphasis on that? I mean, that's like low-hanging fruit as far as, you know, really trying to reach people with a message that is an empowering message, which is, I know what you all advocate, but why do you think that's not out there?
Well, I mean, it's a good question. It's a very complicated question because for some diseases, the link between lifestyle and that disease is more well understood. For example, diabetes or even heart disease. People for years have known that diet and exercise influence heart disease. But even within heart disease, lifestyle and behavioral interventions are not part of the standard of care, even though it's somewhat medically accepted. I think part of the problem is aspects of training of physicians, and that our society focuses more on an illness model of healthcare and less on a wellness model. It's not totally that the incentives are off, but the incentives certainly in the United States are for treating people. There's not a lot of insurance companies until recently that compensate for interventions to keep people healthy, to keep people from getting a disease or illness. And it's true even in countries that have socialized medicine, where you would expect prevention to be front and center. It's just not where it should be, in particular in the areas of stress, diet, exercise, weight management, and even smoking cessation and tobacco control. Still close to 20% of the US population smoke cigarettes or vapes. And, you know, that's a huge number still.
Yeah.
And one of the things that we mentioned in the book was that if they're spending $10, for every $10 they spend on treatments, important, necessary treatments, they're spending $1 on prevention. And with the statistics of, you know, at least 50% of cancers are preventable, that ratio doesn't make sense.
It doesn't. Well, you know, you've said that the mix of six can help in cancer prevention and control. And those six areas sound overwhelming to tackle when people have a hard enough time just eating right and exercising. So where does one start?
Well, the first place to start is no blame, no shame, and no guilt, because you want to start from right where you are in this given moment and step forward with, you know, that you can make change. One of the reasons that we put love and support as the first of the mix of six was that essentially we do not step forward with success unless we have support behind us. And I think that we can all relate to wanting to make a change, stepping forward and failing repeatedly. because we haven't sort of set up a system behind us to support us to make that change. And so we really believe and see with the evidence that you need to have a team of people behind you for a lifestyle change. So if you're looking to work on stress, for instance, you can't just jump in blind. You gather the people around you. It can be your partner, it could be a colleague, it could be an acquaintance who wants to make the change. You sign up together for an online course or an in-person when that's possible. You take the step with somebody else so that you're accountable, which is really important. When Lorenzo, after Lorenzo was diagnosed with cancer and had come through most of his treatment, I realized as the caregiver that I wasn't coping well, and that I needed to find that calm in my own life so that I could sort of sort things out. And so I signed up for an 8-week MBSR, mindfulness-based stress management reduction training. And I got Lorenzo to sign up too with me, because I needed somebody who that we could be accountable together, that we would practice the meditation together, and that it would be something that would be in our lives for the rest of our lives. And we had done meditation before. So one of the things that you need to remember is that you often come back. You start somewhere, and often, if you look at all of the mix of 6, you've got things like reduce your exposure to environmental toxins. So that's low hanging fruit, like you talked about, where every time I buy a new product, it can be more healthy than the last time I bought one. I can, introduce a vegetarian meal once a week. I can, use my Instapot for beans. This has been huge. It's a huge change in our life because it's made it so easy, right? That you can cook from dried bean to cooked bean in less than an hour. So there are lots of different things that you can do, but they're small steps, one at a time, with support.
Say we as human beings are social beings, and we live in community, and there is evidence that community could actually be infectious in a certain way and make you ill. And there's actually data showing that aspects of obesity and an obesogenic culture are part of communities. So to really get healthy and to live the mix of 6, you have to start with that support area. And what's really important about social support that a lot of people aren't aware of, that it in and of itself has a direct effect on what we call the cancer hallmarks, the biological processes that allow us to create an inhospitable terrain for mutations to grow in our body. And people with more social support after a diagnosis of cancer actually live longer and have a lower probability of recurrence of disease, let alone all the quality of life benefits that come from good love and support.
Do hospitals and cancer centers offer resources that people could look into for love and support if they are alone, or if they don't have family that they can lean on?
Well, the origins actually of psychosocial oncology, the role of psychology within the cancer process did actually start with support groups. And some of the early research by David Spiegel and others actually showed that people who are part of support groups actually lived longer. So, from that early work, now it is standard. MD Anderson, pick any hospital system, they all have support groups that can be disease-based or age-based or caregiver support groups, etc. So there are both online, of course, now more than ever, but even before the current way that we live online, there's online support groups as well as hospital-based, community-based. It's one of the things, luckily, that we could say has become the standard of care.
But you know what people need to do? They need to ask. People don't ask.
They do need to ask. Yeah. Even more importantly, they need to know how important it is. And that's one of the things that even with the resources that are available in a lot of medical centers, people don't know. They don't know that it's really important to work with the social worker or the psychologist to make sure they have proper social support. They don't know that they should be working with a dietitian to be able to get healthy nutrition. We have tons of great physical therapists. They don't know they should work with a physical therapist so that they can rehab and recover faster and make sure they have a great exercise regime during and after their treatment. It's like you said, that it's just not brought up as part of the consult.
Yeah. And some other places that individuals could look at are churches. And also, just in your community, there are many resources that are available that people, it escapes me right now, but I'll also include it in the notes, some social services that are available through cities and through counties for people that are in need and may not have the financial resources and don't have family. It's amazing how many people I've talked to over the years that do talk about being alone or feeling alone, even if they have family, not being able to lean on them and talk to them about these issues. So I agree. I think it is the most important issue, because without feeling that, I think it's harder to have the consistency in wanting to make change with diet and lifestyle and all the other things that you talk about.
And
so,
cancer is, while the individual receives the diagnosis, it actually is a family diagnosis. And
I would go further, and it's a community diagnosis.
Yeah.
Right? Because whenever your family is impacted, but everyone else, it touches them, and they're involved as well.
But that's why, and you can be really, like you're saying, alone, even though you're surrounded, and everybody is experiencing that diagnosis from a different perspective. But how critical it is that, that people around you try and see if you need to have that consult with a therapist. One of the other people who's in the book, a patient whose story we share, a friend of hers saw that she was struggling, and as a gift gave her 3 sessions for therapy. And you have to sort of sometimes just step out like that and help people when you see they're in need.
I believe in therapy. I've gone to therapy. I think therapy is great. I also agree with so many of the principles outlined in your book, but Anticancer Living dives into all of that, correct?
It does.
So, I've posted publicly that doctors need training on nutrition. And I get a lot of pushback from registered dietitians who respond that doctors should refer their patients to a dietitian. In my experience, that doesn't happen. That didn't happen in my personal experience, having seen 6 urologists across the country. What do you think should be done, and what can be done?
Well, you come up with the hard ones here with these questions, because you're getting at some of the fundamental issues, and we kind of touched on this with this area of social support. So, we can't provide the support within a medical system for everyone, even if we have great social services. But what has to happen in the doctor's office, literally with the physician, is that they outline the things that are important to allow a patient to be as successful as possible throughout treatment and recovery, and to in some sense view it as a way to get better and to thrive in one's life. And cancer is really a pivot point for a lot of people as a teachable moment. So, ultimately we have to go back to medical school and increase a certain level of education, but we're never going to teach them to be a therapist. We're never going to teach them to be a dietitian, nor do we want them to be. I want my oncologist to be the expert in how to control my disease with the conventional care. But I do need them to say, diet matters, managing your stress matters. You may not know this, but how well you sleep at night is going to influence your cancer outcomes. Oh, and by the way, you can often feel very alone during cancer, and that's not going to be helpful for your outcomes. So it's really important that you get your support set up as well. And here we have a nutritionist, we have a social worker, we have exercise people who can counsel you. We have the expert to support you. But without that, literally 1 or 2 sentences, and we're working actually specifically with our breast center to do formal lifestyle screening and to hear from the medical team, essentially a 2-sentence script, which says it matters. Your weight, your stress, your diet, your exercise are going to matter for your outcomes. And we have the services here to support you.
Should the first question be back to the doctor, do you have a department of integrative medicine? Should they ask that question?
Well, I mean, you can ask that, but you don't even need that. You need an open-minded dietitian who is going to help patients essentially follow a plant-centered diet, a Mediterranean diet, and a social worker. Every hospital has those 2 occupations on staff.
And, you know, so often when you're getting your conventional care, you have multiple physicians who help guide you through the process. And these people are just as important and are part of that team. That team that's based in the hospital environment. And maybe you are, if you're in an area that doesn't have these resources, then you're seeking them outside of the hospital that you're getting treatment at. But the ideal is that everybody works in concert so that you can get the best care. And like the team you need to step forward and make change on your own, you need those 2 teams to come together. So that you can be as successful as possible. So it really helps when your physician is making those recommendations because they know that they're important. And you know that you need to make change in that area, and you seek outside support through your friends and family to help you take on that challenge.
Yeah, I guess what I'm asking is, I find that the feedback that I receive from so many people is that they don't have that when they go to their a cancer center or a clinic to get treatment, they don't have those teams in place. And your book is a great tool to empower individuals to ask those questions. And that's what I'm asking is, what should individuals ask? Because I think it all goes back to asking about those services. What is it that we tell patients when they go to a doctor? If they're not hearing that, what should they ask their doctor? I
would start by asking all of the things like the mix of 6. How important are each of these areas, and where can I find support within this institution to help me make steps forward? And if they don't have the resources, that's when you step out and you start, with your community and your support team at home, finding the resources that you need.
There was actually an interesting survey done out of, I'll put them out there because, they put their names on the paper, from Northwestern, and they surveyed their primary care docs, oncologists, and then other specialists. And they asked them specifically, of your cancer survivors, patients who had finished with treatment, how often do you have a discussion with them about smoking, weight, diet, exercise, lifestyle factors that we know are linked with cancer? And only 20% of the oncologists said they had that conversation. And one of the reasons they said, which, again, a well-intentioned reason, but it disempowers patients, is they said they didn't want to overwhelm the patients, that they were concerned that if you get the patients overloaded, then maybe they're not going to take some of the conventional medicines. Luckily, 90% of the PCPs had that conversation with patients, but essentially they need to have the conversation. So where things can backfire is if a patient, they read Anticancer Living, they're convinced, they think it's important because the evidence is truly overwhelming. We have over 1,000 scientific references that back all of the recommendations that are in there. And they ask their physician, well, does diet matter? The physician may say, no, I don't think it's that important, or I'm not convinced by the literature.
I've heard that.
You have, and I think it's somewhat concerning because, it kind of means that that person doesn't know the literature well enough, or they are, are they concerned that you're going to be harmed by eating, less red meat, when we know that there's this clear association between red meat and a number of cancers. Alcohol, if a patient says, I tend to drink 2 or 3 glasses of wine a night with my meal, not uncommon in our society, do you think I should decrease that? For an oncologist to say no, it's at this point malpractice, but they could. And that's I guess is somewhat concerning. So they need to get, to your question of how do we fix this, they need to get more educated and, simplistically follow the guidelines, because now we're somewhat at a very different time today than actually when we wrote the book, where there are guidelines within oncology care about weight, about diet, about exercise, about doing distress screening on every patient at multiple visits, asking them on 0 to 10, how distressed are you? And if they score more than 4, everything that's supposed to be put into place to help guide this patient.
Yeah.
So it's part of the guidelines, and the organizations are clear on what the dietary guidelines are, what the exercise guidelines are. So we need to just start following the guidelines.
And I think it's important to just let the patients know and not think that they won't follow them, or that it would be too much for them to follow a certain dietary pattern or change it lifestyle habits.
Well, and one of the questions that everybody asks is, what more can I do? Right? You're taking care of my conventional care, and I'm putting my trust in my physician that they know what's the best on that front. But then I want to know what I can do personally. And every patient asks that question and wants to be empowered to be able to contribute to, their own recovery and healing.
And that sense of control in and of itself is extremely powerful and healthy for people.
Since I've known you, you have always emphasized the importance of mental health in managing chronic stress. And you always say that chronic stress is the saboteur of all healthy intentions. Explain what that means, because it's brilliant, and I believe that.
Well, I mean, all the listeners know this because everyone lives with stress. We tend to at times have it overwhelm us, or we control it well. The events in our lives are not things that we can stop from happening, but it's how we respond to them that we are in control of. And uncontrolled chronic stress, it literally gets into the tumor microenvironment, making it hospitable to cancer growth. The flood of stress hormones, in particular norepinephrine and cancer, stimulate cancer cells to grow. They literally have receptors on the cells where the stress hormones will bind and make them grow out of control and metastasize, etc. But we also know that chronic stress will disrupt your interest in exercising. It will disrupt your sleep, and you won't sleep as soundly, and you wake up in the middle of the night, you won't be able to fall back to sleep. It's obviously horrible for relationships that you have. And perhaps even more surprisingly, and it was a brilliant study done by Jan Kiekel-Glaser out of Ohio State University a few years ago, where she actually showed that chronic stress changes the way you respond to food, such that she did this very elegant study where patients ate an unhealthy meal, let's call it, and a healthy meal. And people who are chronically stressed, when they ate that healthy meal, they had the same response as somebody with no stress who ate the unhealthy meal. So essentially, stress was negating some of the beneficial effects of eating healthy food. And again, it's not surprising, because when you're chronically stressed, your body's constantly being flooded with these stress hormones that change all aspects of our biology.
And this is how I look at that statement too, and this is how I relate to it. So before my diagnosis of prostate cancer, I'm 6'3" and I was 235 pounds. I ate chicken fried steak every week, 4 to 5 times a week, I would eat hamburgers, lots of fried chicken. I ate terrible food. I ate delicious food, but it was terrible for me. I'm 195 pounds today, 100% whole foods, plant-based. I feel better than I ever have. But for me early on, even though I knew and I became educated on what the right dietary habits would be for me to slow the progression of my early stage prostate cancer and reverse it, when I did not have my stress under control, I would binge eat. I would also drink a lot. I would go back to old habits and I would keep falling backwards. And sometimes it felt like it was 3 steps back and only 2 steps forward. And I would continue to slowly go back and back and back, which is why for me, I had to see a therapist and talk about these issues and get to the root causes of managing that stress, because it was chronic in my life. I wasn't, anytime there was a trigger, I would act on it. So for me, when you say that it is the saboteur of all healthy intentions, I had the intention of exercising and doing more yoga and eating more plant-based. But anytime these things would come up that I wasn't managing, boom, I'd go back to those bad old habits. And I think a lot of people are like that too.
Well, and what I would say is, that you recognized that you weren't making progress, and that was a sign that there was something else deeper that you needed to address. And so, bravo for figuring that out and for working on it and knowing that it was the missing piece. And for many of us, we have deep-seated issues that we are all working on. And so it's important to know that moment when it's time to step up and get some help in therapy or whatever area.
And this is an area we spend a lot of time on this chapter, and even some of the pre-chapters around trauma, because if we think about stress from an evolutionary perspective, it was extremely adaptive, right? What people know of colloquially as the fight or flight response. And it allowed us as a species actually to survive, thrive. The individuals who had the most acute sensitive stress response were the ones theoretically who were able to live longer and procreate more. So we've evolved from individuals with this super sensitive stress response, but it was typically an acute stress response, meaning short-lived. Now we live in a world where, of course, there's still acute stressors that are happening all the time, but there is tremendous chronic stress. And the response of the brain and the body is fight or flight. So you're under this constant fight or flight. So how are you going to prioritize eating a healthy meal if you think you're in fight or flight mode? You're going to actually crave foods that are high fat, high in calories, because that's good for survival, right? Because stress historically was somebody was attacking your village, or there was going to be a famine, bad weather. You actually keep fat on your body more when you're flooding your body with stress hormones, because evolutionarily that was good. It allowed you to survive that long cold winter if you had more fat on your body. And so, this is really hard because it is deep within our brain, these types of responses and how disruptive they can be. So the key, and we outline a number of different strategies, but the key is to find the one that works for you, is to try and bring calm into your life every day. And when necessary, like you have done and many others who are successful in this area, bring somebody in, a mental health care professional who is trained to help navigate this very hard part of our modern world.
Go ahead.
Well, I was just going to say that, a lot of us live in households with other people. So whether that's children or parents or grandparents, and, we look at it for our kids, however successfully we're trying to do it, and not always successfully, that we're giving them the tools that we didn't have, because we didn't have these mind-body practices growing up. But the more that we can expose our kids to it and the family around us, the more we know that they're going to have the tools when tough times come for themselves.
And little things can make a big difference. I remember years ago when I would meet with Lorenzo at MD Anderson for a meeting, he would want to do a walking meeting in the park.
Yeah.
And just that walking meeting planted a seed in my head when I had meetings with other people. And I actually did that. And it's in Anti-Cancer Living, a little bit about my story, and how I embraced that and really pursued more time in nature and away from the noise. And anyone can do it. It doesn't matter. They don't have to live in Big Sur, California, or any beautiful mountainous area. I saw my father the other day. We went to Walmart, and my father was in a motorized cart at Walmart. You know, my once muscular, very athletic father, he's recovering from stroke. He's obese. He has hypertension, high cholesterol. He's at high risk for being hospitalized and dying from COVID. His mother was obese and died from a heart attack. His brother was obese and died of a heart attack. His father had hypertension and died of an aneurysm. His sister had an aneurysm. And two of my father's first cousins recently died last month from COVID. They were both obese. Mm-hmm. My father tells me all the time he doesn't want to die. But he continues to make poor choices, and I'm very encouraging every day when we speak. But I grew up with my father always telling me heart disease runs in our family. And of course, I realize it's poor dietary habits that run in our family. Please share with the audience how the principles in anti-cancer living aren't just for cancer. Those principles can be really for all of the chronic diseases that are ailing Americans, right?
I can't say it better than you just said it. I mean, it's true. You know, these are our lifestyle diseases. The primary cause of death in our society, that what are called non-communicable diseases, cardiovascular disease, which is heart disease and stroke, cancer coming in number 2, depending on how you count things, diabetes, Alzheimer's. That accounts for the majority of deaths actually in our world. Now, you know, it's not all preventable. There are some, you know, you use the term runs in the family, and there are genetic mutations that you inherit from your parents that can increase your vulnerability to different diseases, but it doesn't mean that your fate is written in stone. And so all of the mix of 6 apply to setting up your body to be as healthy as possible. And one of the underlying mechanisms, and we talk about this briefly in Anti-Cancer Living, behind all of these diseases is inflammation. And so, you know, the mix of 6 is the right way forward for illness prevention and wellness promotion.
Yeah. Absolutely. And that's why I believe in that. I mean, the things that you have educated me on over the years are the things that I've encouraged not only the Blue Cure community, but many people that I come across, especially the emphasis since I've known you. There's always been a huge emphasis on mental health and stress management. And to me, that was always just, and that's the same with my father, is that my father has never slept well. He has always been very poor at managing stress, handling conflict too. He's very poor at conflict resolution. In fact, my father just told me the other day that he's been on sleeping pills for 35 years, 35 years, and he still doesn't sleep well. Wow. And so, yeah, he has a lot of health issues. But the sad thing is that we live in a culture and society where doctors just write these scripts and don't ever, my father has never had discussions with his doctors about his dietary habits or his lifestyle habits. But of course, with me and with the people that I know and the things that I've become educated on, I've really tried to encourage him, because I know that you all believe this, that finger wagging and finger pointing doesn't work.
No.
So slowly but surely there are slight changes that he's making, but it's just really challenging, when that's how you grow up and you see modeling in front of you, that's poor conflict resolution modeling, and you grow up in the 60s eating very poorly, where you are taught that just slabs of red meat with fat on it are really good for you, and lots of burgers, and that's just how they were brought up. But
and the stigmatization of mental health issues, and when it comes up, looking for a pharmacological answer, which may be appropriate, but it's really important to try the non-pharmacological ones, for which there is tremendous evidence. Cognitive behavioral therapy for insomnia should be the go-to treatment, and we have a whole section on sleep and sleep-related issues. In Anticancer Living. CBTI, as the acronym is as effective as sleep meds. And Tai Chi, just as one example, is as effective as sleep meds as well as CBTI. So there's these very conventional approaches that maybe, because as a psychologist, it scares people, but then try Tai Chi, try yoga.
Yeah.
And you can do it alongside sleep meds and then maybe back off the sleep meds. But, the interesting thing about sleep meds is they there's not a single sleep med that allows people to get into deep sleep, stage 3 or 4. So you may feel like you've had a good night's sleep because you weren't conscious between 10 p.m. and 6 a.m., but you never got into that deep sleep, which is the critical restorative sleep, both at a psychological level as well as at a biological level. But things like meditation actually change the brain in a way that allows you to get into deep sleep.
Give us an example of, ideally, what would a day be of what you would eat for breakfast, lunch, and dinner. And then throughout the day, whether it's a work day or a weekend, what would you do to relax or manage stress and just go throughout your day?
Well, I'll just use our example, and it's never always consistent. So we have green tea when we get up in the morning. We have about 2 cups over the course of the day, and I was a big coffee drinker before and have managed to make that shift over time.
The coffee has wonderful phytonutrients in it. So, keep up coffee drinking if that's your drink of choice. Add in green tea too once in a while, but coffee's super healthy.
So we have that. Lorenzo purchased, while he was a couple of years ago, a recumbent bike that he kept stored under his desk at work. He brought that home with COVID, and he has it in the dining room, which is his office. And so he jumps on that in the morning, and I do some yoga, and then hit my desk to work. And then mid-morning we have a cereal that is a concoction of different grains with different spices like cinnamon and nutmeg and cloves and turmeric, and the grains are barley and a whole host of
oatmeal, essentially these healthy fermentable fiber grains that are going to be classified as prebiotics to feed all the healthy bacteria that's in our gut.
Because we're really trying to work on having a healthy gut, because we know that connection between the immune system and gut health. And then lunch is usually leftovers from the night before, because we really don't want to have to cook every day. And so we try and make batches of things. And one of our go-to is coleslaw, that we put all kinds of vegetable, broccoli, cabbage, carrots, cilantro, etc. And then we just put that undressed into the fridge, and we pull it out and top it with nuts and with tofu or a little side of beans. And that's kind of our go-to lunch. And then I should say that, we walk the dog. We take turns walking the dog, and Lorenzo has walking meetings. to be out and about. And then before dinner, we have started, because of the enormous stress that we're all finding ourselves under, we've started doing meditation with our daughter every night before dinner. And so we do Headspace. Headspace has a program on Netflix where they teach you a little bit about the meditation, the type of meditation you're going to do, and then you do a short meditation together. And so, we used to meditate with our kids a lot when they were young, and we really felt like we needed to circle back to it because things are really challenging right now. So we've been doing that. We have dinner together, which Lorenzo is vegan, and the rest of us eat everything, but we're probably 85% vegan at home. And we have beans and more beans and tofu and lots of vegetables.
The thing about the stress and meditation practice is it doesn't have to be long. So these, what was so smart about Headspace going on to Netflix is the whole thing is 20 minutes. So it's a 10-minute talk and then 8 or 10-minute brief meditation that you can of course extend, but it's also very accessible, and I think the 20 minutes is not a coincidence. That happens to be the amount of time that people are allowed to speak on TED stage. There's sort of like, there's this 18 to 20 minute attention span that people have. And so it doesn't take long. And we know from a lot of research that even just 10 or 15 minutes of calming, relaxing the mind, doing diaphragmatic breathing has a profound effect all the way down to how our genes behave and express themselves, decreasing inflammation, improving the immune system, just 10 to 15 minutes a day.
And
how many hours a night of sleep do you all get?
I was just going to say to you that the end part of this that's so important is getting into bed, because it really has been the thing that really we can feel it every single day if we do not do it well. So we're usually in bed by 10:30 and up by, 7. Around that is 7.
In the COVID world, things have shifted.
A little bit shifted.
The time, but the amount of time of sleep is, Alison, I think, needs more sleep than me, but it's all within this range of 7 to 9 hours. And the data is overwhelming. The data is overwhelming. And there's listeners are like, I thrive with 4 hours. I do what it's like, you don't. And your body's not doing well with 4 hours. And you could do your own little experiment with different measures that you could look at, but the data is clear that 7 to 9 is that sweet spot. And people who sleep 6.5 hours or less have increased vulnerability to all chronic diseases and the worst disease, which is early death.
And what can't help is the number of people that are taking their smartphones to bed. I've read so many studies that I'm sure you have too, that how disruptive that is to watch and to scroll before you go to bed, that it still triggers something that just, doesn't allow you to get deep sleep.
Well, and it's
or good sleep.
It's so traumatic, actually. The news is so difficult. There's been so much loss and suffering, and to enter into that just prior to bed, or to be looking on social media at everybody else's life. I've heard it described that, you want to sort of slowly get into sleep, and you take steps essentially down to sleep. And so, reading before bed, not having your phone in your room, not watching television, giving yourself that time, that half an hour to really, get ready for sleep and then be able to sleep well.
And you said something that I think is one of the most important actions that someone can take is to reduce your news consumption, reduce your social media news consumption. I can personally say that last year, I was overconsumed with it. I was making that choice of scrolling throughout the day on my Facebook news feed, my Twitter. It affected me. And I had to take those apps off of my phone. And I also had to not unfriend in real life, but unfriend and unfollow a lot of people where all they were posting was just a lot of really heavy political stuff every single day. And, you know, I figure we choose our happiness and we choose what we watch and what we see and what we absorb. And I couldn't deal with that anymore. And I still have friends that every day, because I don't see what they post, they send it to me in text. I've told them, you can't do that. Can't do that. Boundaries are important. And I know y'all agree with that. It's important to let people know what you will accept and what you won't. And I do think a lot of this, I mean, that's another wonderful lesson from this book, is learning that we also have choices, and those choices are also in setting boundaries. We are empowered to make choices that can really, you know, make the difference in whether we live a higher quality life or whether we die early. And so I want to thank you all for your time. And this is such an important book. Is there anything that we didn't cover? I know there was a lot we didn't cover, but is there anything you want to leave that you want to share with our community, our audience?
Well, I don't know where to start. There's tons. No, I think that just the most important thing to remember is that there's synergy, and that success in one area, you know, that you're having success in areas, even if you're really concentrated in one, you've got success in some of the other areas, and that really helps. So that positive synergy that you're trying to create is critical, and that you can do this and get your team, you know, behind you.
And each new day is a new opportunity to do better, and to live more of an anti-cancer life. And you know, it's not about a particular diet, a particular kind of exercise. It's about a pattern of how you lead your life. And somebody asked after a talk, which were typically peppered with questions around diet, you know, this food, that supplement. And somebody said, well, you know, what about the holidays? What about when we, you know, we know we're going to eat too much and some rich foods? The answer is, well, you know, double down on exercise and your meditation. It's not going to counteract all the negative effects of food, but certainly it's going to help. So it's all interrelated, and you know, view it as you know, that we live in this ecosystem that includes us, each other, and all aspects of the mix of six.
And one last thing that we haven't mentioned is that it's as important to give as it is to receive. And so as if you're the one with the cancer diagnosis, or if you're the caregivers, or you're the family surrounding, there's real scientific evidence that this is actually healthy for you. So to be giving to somebody else, to be helping somebody find the resources that they need, or providing that support and being that cheerleader, or driving somebody's kids to school, all of those things really matter. So whether you're the person who has the cancer diagnosis, or you're somebody in their community.
Thank you. And I want to remind everyone that Anticancer Living is available at at your favorite bookstore. It's available on Amazon.com. If people want to know where you will have a speaking engagement, or to keep up with y'all, you have a newsletter, or you have a sign up on your website, correct? Where people can.
Well, you can check in at our website, because that has all the information about what we're doing at anticancer-living.com.
As well as all your social media, which is Anticancer Living.
Yes.
Good deal. Well, when all this is over, I look forward to seeing you all on the road, and I'm sure you will be out there. This is a wonderful book. People should also buy this for their physicians because they also need to learn what's in this wonderful book. Thank you all. I look forward to our next one, and y'all have a wonderful, wonderful rest of your week. And I appreciate all that y'all do.
Thanks, Gabe. Thanks for doing the great work you're doing.
Thank you so much.
All right. Y'all take care. Thank you.